Hello and welcome back to ZurMed. My name is Dr. Uslar, and today I would like to talk about a very, very common problem that many patients that I treat have. It's problem with thyroid gland. Why is it so important? First of all, the problem is very common. I would say that from my patients, about 20% have one or another thyroid issue. And it makes it so common that basically knowledge about thyroid gland, its function and its treatment becomes very important, not only for the doctors, but also for the patient to take a better care of themselves. So what do usually patients come with when they have thyroid issues? We have to differentiate whether the thyroid function is low or high. And there are different medical categories when the thyroid can function insufficiently or when it functions too much. So let's start with the low thyroid function because it's a way more common. Usually, patients come with very typical symptoms of inability to lose weight. They gain weight very quickly. They feel tired. They have hair loss. Their skin is dry. They feel low energy. Sometimes they have difficulty sleeping, and sometimes they have extreme fatigue. And of course, when we check blood work, when we assess a patient for a certain medical problem, thyroid is included when a patient comes with these symptoms. Another type of thyroid disease is too much function. And in that case, patients usually come with irritability, anxiety. They have also hair loss. They can have problems with the digestion. They may sleep very, very poorly. They may also feel very hyper-excited and nervous. Also, the blood pressure may be higher than usual and other symptoms of this kind. Why do we care about thyroid hormones and why do we care about the proper function of the thyroid gland? This is because thyroid is one of the most amazing organs in our body. It is very, very adaptable to whatever circumstances we are in. Let's say we are undergoing stress, a surgery or other type of stressful event. Our thyroid is able almost in real time produce extra amount of hormones or reduce the production of hormones to adapt really, really quickly to a certain situation. It's basically a gland that regulates how much hormone we need pretty much in real time. That's why when we undergo, let's say, treatment, surgeries, we're sick with something, thyroid is the gland that regulates what is needed. Thyroid hormones are very, very important for metabolism, for energy production, for burning of fats, for processing of carbohydrates, for, in general, for metabolic processes. That's why patients with thyroid problems often suffer from weight issues. Another function of the thyroid hormone is activation of so-called fight and flight reaction. Let's say we very quickly need to mobilize our resources to do some stressful task. Thyroid gland will be there to help us with production of hormones and preparing the body for a certain stressful event. That's why understanding of the thyroid gland is so important. And in my office, we routinely test thyroid gland even in patients without any symptoms, because sometimes there are precursors of thyroid problems that are visible only on lab work, and they can help us detect the problem very early and monitor it and treat it probably even before the problem becomes very big or very noticeable to the patient. If you are experiencing any symptoms like weight loss, sweating, or weight gain, any symptoms related to metabolic activity, any symptoms related to sleep, skin issues, it can be thyroid. Think of that. Ask your doctor to test your thyroid gland. Very frequently, the conditions of the thyroid disease are benign. That means they are not cancerous. But very occasionally, it can be also a cancer. That's why it's very, very important, if there are any abnormalities, to investigate further and do an ultrasound of the thyroid, determine certain markers in the blood, and accordingly make a diagnosis. I hope this video was very helpful to you. And I hope that if you notice any changes in your body or any symptoms, you will think that a thyroid can be an issue and ask your physician to help evaluate and assess that. If you have any very specific questions or general questions or anything you think I could be helpful with answering, please call me at 617-712-6539 or write me an email at dr.uslar@gmail.com, dr.uslar@gmail.com, and I'll be very happy to help you.